Hello and welcome to our nursing education channel. Today we're diving into the critical procedure of blood transfusion and the essential roles nurses play in this process. Let's get started. We'll break down the blood transfusion process into 5 key stages, highlighting the nurse's responsibilities at each step. The first stage is the pre-transfusion assessment. Here's what you need to do. Verify the physician's order for blood transfusion. Check the patient's medical history for any previous transfusion reactions. Assess the patient's current condition, including vital signs. Ensure informed consent has been obtained. Let's say we have a patient, Mrs. Johnson, who needs a transfusion due to severe anemia. Before we begin, we check her chart to confirm the doctor's order, review her history for any past reactions, and take her current vital signs. The second stage is crucial, verifying the blood product. Remember the rule of 2. 2 nurses must independently verify patient's identity using 2 identifiers, blood product details, compatibility of the blood with the patient, check expiration date, and inspect the blood bag for any abnormalities. With Mrs. Johnson, you and a colleague would both check her wristband and ask her to state her name and date of birth. Then, you'd both verify that the blood type on the bag matches her type and check that it hasn't expired. Next, we prepare the patient for the transfusion. First, we explain the procedure to the patient. It's important to ensure that the IV access is patent. If there are any pre-medications ordered, we administer them at this stage. Recording baseline vital signs is crucial as well. For example, we'd explain to Mrs. Johnson what to expect during the transfusion, check her IV line, and take her vital signs. If she's anxious, we might take extra time to address her concerns. Now we're ready to start the transfusion. Begin the transfusion slowly for the first 15 minutes. Monitor the patient closely for the first 15 minutes for any signs of reaction. Check and record vital signs at specific intervals, every 15 minutes for the first hour, every 30 minutes for the second hour, and every hour until completion. Monitor for signs of transfusion reaction throughout. As we start Mrs. Johnson's transfusion, we'd stay with her for the first 15 minutes, watching for any signs of reaction like chills, hives, or difficulty breathing. We'd check her vitals according to our schedule and keep a close eye on her throughout. Finally, we have post-transfusion care. Disconnect the empty blood bag and flush the line. Perform a final set of vital signs. Monitor the patient for delayed reactions. Document the entire procedure thoroughly. After Mrs. Johnson's transfusion is complete, we'd remove the empty bag, take her final set of vitals, and continue to monitor her for any delayed reactions. We'd also make sure to document every step of the process in her chart. Remember, as a nurse, your role in blood transfusion is critical. Always prioritize patient safety, follow proper verification procedures, and stay vigilant for any signs of transfusion reaction. That wraps up our guide to nursing roles in blood transfusion. We hope you found this informative. Don't forget to like, subscribe, and hit the notification bell for more nursing education videos. Thanks for watching.